All right, Christian, if you want to get us kicked off here.
Well, I appreciate everybody for joining us today. We're excited to partner with TexProtects and Protect Child Abuse Texas in order to have a discussion about legislative session, what we're entering and where we're going. And so we'll give a little bit of updates about us, and then TexProtects will be taking it from there. So we're excited you were spending your afternoon with us. We know it's about 3 o'clock. Food is settled in. It's closer to the end of the day, and I just appreciate you guys taking time to join us.
Carrie, you want me to take it away?
Go for it, Knox.
All right. Christian, you were incredibly succinct and brief. Man, have you got that message down, my friend? Thank you so much. We are very excited. Knox Kimberly, by the way, interim CEO of TexProtects, and I want to welcome all of you here today and express our gratitude to St. Francis Ministries for partnering with us in this effort. We're very excited about being back here with you again, Christian and your group, and looking forward to today's conversation very much. We thank you all for joining us for what we actually consider to be part 2 of this town hall. Our team enjoyed very much hearing from all of you about a year ago at this time on some of what was going on in the community, some of the most pressing issues you were seeing in order to help guide our policy and advocacy efforts during the interim period between legislative sessions. And now we're back on the doorstep of a full legislative session that will begin in January, the 88th Texas legislature. And, you know, all of this work is about making sure that we are effectively supporting children and families across our state. And we're looking forward to the conversations again today, and we want this to be interactive. So our plan here is that I believe Carrie Giudice of our team and Christian will lay out priorities, kind of a survey of the landscape of child protection in our state and how child well-being is being promoted or hindered and so forth. And then we want to use the rest of the time to hear from all of you. We want to learn what you are doing, working on, observing, trends that you're seeing, in order that we can effectively understand all of that from this community and other communities across Texas, determine how that aligns with the priorities and the areas of effort and policy that Carrie and Christian will lay out, provide a space for you all to give us any updates, and probably most importantly, figure out how we can all join forces to get these priorities across the finish line in the upcoming legislative session. Now I want to express our gratitude to our sponsor for today, the Texas Child Welfare Funders, who are represented by their Vice President, Christy Robinson. Christy has been involved with her family's foundation, the Hoagland Foundation, since its inception in 1989. She serves as their program officer, has been an active board member for 32 years, and makes all of the major funding she would say, I will say decisions. She'd probably say recommendations to their full board, but I have a hard time believing that any recommendation she would present to them would not be approved, because she is just such a rock star in this area. And, you know, the other thing about her is, Christy, is that she walks the talk. She is very interested personally in the well-being of children, serves on the Dallas County CASA board, is a CASA advocate herself, and is part of the Dallas County HOPES Advisory Council, another bedrock prevention program, and has been involved with the North Texas Welfare Funders Group for years, and now with the statewide Texas Child Welfare Funders Group as their vice president. So, and finally, and gratefully, a huge supporter of all things in which TexProtects is engaged. So, Christy, we'd love to hear a word from you before we jump into the rest of our program.
Sure. Wow. Thank you, Knox. That was great. I really appreciate that. Like Knox said, The Hoagland Foundation is a small family foundation in North Texas, and we have supported TexProtects for 10 or 12 years, and just it's the best bang for our buck really in the advocacy world. So we're thrilled with TexProtects, but I'm actually here with a different hat on today. I am Vice President of the Texas Child Welfare Funders, and this is our second year to sponsor the TexProtects Texas Tour, and we're thrilled about it. We're thrilled that the Texas Tour for service providers and funders, and it's just people who deeply care about child welfare in our state. You can see on the slide there that the purpose of the Texas Child Welfare Funders is to optimize child welfare from initial report to permanency. So we're a non-partisan educational peer group, and we are under the umbrella of Philanthropy Southwest. However, you do not have to be a member of Philanthropy Southwest to join the Texas Child Welfare Funders. And like Knox said, this group kind of grew out of another, the North Texas funders, and there was enough interest statewide that we took a big leap in 2019 to go statewide, and our first meeting was May of 2020, or was supposed to be May of 2020, and that got canceled, and the one in 2021 got canceled, and finally we had our first in-person meeting in April of this year, and things are kind of starting to rock and roll again. Excuse me. We currently don't have any dues. We just operate on voluntary donations, and we have podcasts, virtual meetings, newsletters, webinars. We just, we have a great resource page under the Philanthropy Southwest page. And we are just trying to help funders statewide stay current on kind of the state of the union of children in care in Texas. So please don't hesitate to reach out to me or anybody else on this list if you have any questions. And we just want to thank TexProtects again for this opportunity to help create a dialogue about child welfare in the state. So thank you very, very much. And I really look forward to hearing from you again today.
Christy, thank you so much. I'm just jumping in real quick. I'm not going to say many words. Just wanted to let you all know we are going to kind of enter into that time of legislative priorities. Christian's going to hop back on here and talk about those priorities from St. Francis. And then the TexProtects team will follow with what we are focused on for session. So Christian, I'll go ahead and pass that over to you.
Thank you, Carrie, and appreciate you, Christy, for supporting this event. It's really huge to get into our communities again and to showcase that there's so many people that are pulling for kids and families in our communities and around Texas. As I alluded to earlier, I'm Christian Garcia, St. Francis Chief Advancement Officer. Most recently moved into this role in the past couple of months, actually, transitioning from leading the SSCC and Regional 1 along with several other programs in our southern areas. So it's really our privilege to be on here and have the opportunity to talk to you all. I see as I'm looking through who's on right now, just a lot of our partners who do this work daily. We're constantly working to work with families and children to heal the process. So thank y'all for joining. Let's kind of jump into what we're excited about. I will go into kind of the legislative priorities, but I do want to talk about since we've had the ability to transition our work on March 2nd, we've been able to increase reunification rate. Part of our philosophy at St. Francis is that children need to be home in safe environments with their biological family. If we can start doing that that upstream work long-term, then hopefully there's not a need for case management, right? And so we're excited that at this point, we're averaging about 50% of our kids in our care are going back home safely. This is exciting work. If you think about where we've been at for the past several years, that's ranged anywhere from 30% to about 45% under the legacy system. And so we're seeing some small incremental changes in that, which is the movement we want to go towards. Another highlight is children placed in their home community. This has been a drastic jump, about 17 to 18%. Since March 2nd, there's a lot of contributing factors to that. It has to go back to decision-making, really looking at kinship relatives, really focusing on getting kids back home into their environment, absent fathers, and those types of folks who have really taken this on and really driven this numbers, along with capacity building funding. We've been able to work with our partners in the Region 1 or the Panhandle area to really look at how do we incentivize kids staying home to help support that piece of it. And so we're really excited about how this percentage continues to climb, because as you look at the percentage, one of the things you have to factor in is that's a child, right? That's a kid back into their community, a place they're familiar with. And what we know from the research is that when kids are in their community, it typically leads to permanency quicker, and also leads to kids going back to their home environment or their biological family, which is a really big piece of it. I think at the end, the very bottom there is siblings placed together. And the reason I highlight these is this is historically where we've struggled in the first 2 years of our work here in Texas in stage 1. But as you're going into stage 2, and we're in that right now, siblings placed together, we know that kids need to be together. And changing the cultural ideology around that's important to us. We know that children thrive when they're with their siblings, and they have a place of healing when they know that their siblings are with them and safe. And so we're really excited about the 65% number that we've been to. This is another one of those that's driven up about 17 to 18% since March 2nd. And we'll continue to push that piece of it as kids need to go back. They need to be placed with their siblings if they're in out of home. They need to go back to their community. And then at the end of the day, we need to make sure kids are reunified back to the families they belong to. So just kind of wanted to start there. So as we go into legislative session, one of the things I'm appreciative of is we have external partners like TexProtects and some other folks across the state who share very common themes, right? We may have language that's a little bit different, but at the end of the day, we all want the same thing, or we're all looking at the same priorities, which is really good when all your partners are on the same page. The secondary piece of that is the SSCCs at this point. We collaborate and work together to set legislative priorities as a team. And so we all get to collectively work as a group and decide what is important to us and what's important to our providers and folks that we serve in our contracts or folks that work with us. One of the things I'll note is the liability and risk. The cost of insurance has risen in the past 2 years significantly. When I think about St. Francis in itself, our insurance has risen by millions of dollars. And what that does, or the challenge with some providers is they can't even get insurance, right? Partners aren't willing to even insure them. So when we're thinking about capacity, we're thinking about being able to pour to kids and families, rising insurance costs typically don't help that piece of it. The fact that you can open a new operation, but you can't get insurance to support it is always going to create some challenges. So we're tackling this as a group to try to see how we get to legislation that focuses on liability and risk, and how we can ultimately reduce those costs for our providers and our various folks who are doing this work. We strongly support family preservation. As a collective group, we know we have to go upstream to keep families together before they're entering the system. And what I'm proud to say is we're in the process of piloting through House Bill 3041, family-centered treatment in the Panhandle. And what's exciting about this is what we've seen as we've rolled out this evidence-based practice in several different states. In some areas, we've been able to reduce removal of children by 46%. And families have been successful 95% of the time. We know this works. And so we're excited that we're able to pilot this piece of it and hope that the legislature continues to carry on with funding opportunities for our partners and other folks and ourselves to continue this work moving forward, as the upstream piece of it is how we truly keep families connected and together. Funding, focus on correct rates for the cost of care of children, including rate modernization, which is already out there, provider rates and daycare. This has been something that's been a challenge to us since stage 1, and that's the daycare cost and what needs to happen around that. Had a very good conversation with Senator Charles Perry recently, and just said anybody that's taking care of a kid in the system deserves childcare. And so how do we get to a yes around that is going to be important, along with rates that actually cover the costs that are of the services that you guys are providing, our partners are providing to kids and families. It's going to be as you start seeing some of those other costs rise due to inflation and liability and risk, cost of fuel, so do costs for our providers. So ensuring that there's a rate methodology that captures that is a top priority for us. And interoperability, we all work through various systems and they don't talk to each other is the biggest challenge. So system improvement is such a big piece of where we need to get so that we can have good and accurate data and we can have good and accurate information for our kids and families. Integrating those various points through APIs or other processes is going to be crucial as we start getting to a place of yes. And we hope the legislature takes this on. We already know there's been some appropriation towards that. And so we're excited to hear that this is going to be another top priority to make sure that our data systems are talking to each other so there's not so much duplicative work. Because again, that's one of those things that takes us off our focus of caring for children and families well. And that's all I got. Thank you, Carrie.
Thank you so much, Christian. Really appreciate you sharing all of those priorities. I know you'll see, I think a lot of the themes echoed in our legislative priorities as well. We are just so happy that you all are with us today. My name is Brittany Taylor Ross, and I am the prenatal to 3 policy manager here at TexProtects. And I am joined with members of our policy team, Carrie Judice, who is our child protection manager, and Emily Williams, who is our mental health policy fellow. As Knox mentioned earlier, we had the honor and privilege of going to 8 different communities previously. I was trying to think if it was last year or the year before that. Time is irrelevant now. And hearing from folks like you all, and one of the themes that really echoed loud and clear and that you're going to hear us repeat several times today is really, that we are seeing an overall lack of support for children and families, that we can't just do more of the same and keeping to that status quo, and that we should really be investing more in keeping families together. So we took all of this great information, we talked with lawmakers, we observed interim hearings at the Capitol to try to figure out what was not only feasible, but what would have the most impact leading into this legislative session. So all of that together helped us to land on our official legislative agenda that we are excited to walk through with you all today. So for those of you who aren't familiar with who we are, TexProtects is the only nonprofit, nonpartisan advocacy organization in Texas that is singularly focused on the prevention of child abuse and neglect. And we are also proudly the Texas chapter of Prevent Child Abuse in America. Through education, research, and advocacy, we promote smart strategies all along the prevention spectrum to hopefully prevent child abuse and neglect from ever occurring at all, but also for strategies that help keep families together, to prevent removals, and for the best interest and safety of kids in the state's custody through CPS. So as I mentioned, we took what you all had to say and looked at the data and looked at what the data and research is really telling us. And I think what you'll see here today is that the information really points us to why it is so necessary to better support children and families in our state. So let's go ahead and jump into a bit of that data. So as a state, we really wanted to look at how are we doing compared to the national average when it comes to caring for our children. We all know that Texas likes to be the best at everything. We like to be #1, but we aren't quite there yet when it comes to better supporting families in our state. So according to the State of Babies report from 2022, there are some things that we're doing well and some things that we're not doing very well when it comes to serving families in their communities. And you can see here that we have more children who are uninsured in Texas, less families who are receiving benefits overall, and just overall less resilient when it comes to family circumstances. So what does this show us? This really shows us, again, that families are in need of support, and we really need to be rising to the occasion to help out these families as a state. And here's another way that we looked at that led us to believe that families are in need of support. We know there are resource and referral networks like 211 and localized networks like Help Me Grow, but we still have families calling the abuse and neglect CPS hotline because they just want to be connected to services and they don't know who else to call. You can see how steady this trend has been. Over the last decade, 4 out of 10 calls to the hotline or just because a family needs a referral to somewhere else in the community. We're excited to report that the Department of Family and Protective Services has recently launched what they're calling their parent helpline. That it's supposed to be, somewhere where parents can call for, education questions, support. So we're really curious to see kind of what this does with this trend. And we hope that this means that families will be able to be connected to the resources that they need. And I'm now going to pass it off to Carrie to talk a little bit more about this.
Got to unmute myself, y'all. So going to continue with this theme of the support or the lack of support. So what we also know is that more investigations are actually being closed out statewide without being referred to family-based safety services, or FBSS as a lot of you know it, which is really that stage of service that is in place to provide families with the supports that they need and to prevent removals. And so, I'm looking at the screen here. This top line is the statewide trend. The bottom is more what's going on in y'all's area. And so it would appear that in some ways, some things have increased actually for you guys versus the statewide trend. So I'd love to hear a little bit more about that, what may be going on differently there. But in general, there have been some dips in time, but it seems to be on the rise again. But what I would just say generally, what we're talking about statewide and what we're seeing statewide, just because a family isn't referred for those family preservation services doesn't necessarily mean that the family wouldn't benefit from services. So if ongoing support isn't being provided through CPS, this means we really must rely on communities to reach those families outside of CPS intervention. And we also know, which I'm sure if you've jumped on any of our calls or anybody that's working on child protection, you will have heard already that removals are down statewide. Overall, we've seen removals drop about 40 to 50% over the last year and a half. Some areas have been impacted more than others, but really the overall trend is a decrease in kids coming into care. For the Panhandle, again, so we've got that top line being state, the bottom being what's going on in y'all's area. It would look like there's been a little bit more of a bumpy ride throughout this time period, but overall removals have significantly decreased here as well. So similar to what you heard me say about FBSS referrals being down, I would say again, just because there isn't that level of evidence that's needed to perform a removal doesn't mean that families wouldn't benefit from supports. And so I will just go ahead and interject here that if you're kind of going, Carrie, why are removals down? What are you hearing? There's been a lot of speculation, honestly. The truth is it's hard to pinpoint just one thing, as a lot has really changed over the last year and a half. There have been a number of internal policy changes. For instance, CPS implemented what's called concurrent stages between investigations and FBSS, where they can jointly start working a case as soon as they know the family would benefit from services. And ultimately, that's to promote, families staying together. But what we're hearing is that this is resulting in cases actually being closed out sooner. So we know that there's kind of being some course correction there within the department, but it is what we've been seeing. We also know that another internal policy change is one where it's actually going to require more approvals up the chain to be able to remove kids that are 12 and up. So between, the internal policy changes and what we know last session, y'all heard us come and talk about how there was a change in the neglect definition. Y'all heard how there's the repeal to non-emergency removal so that those no longer can happen. Between, again, internal policy changes and the changes that we know that the legislature wanted to see, we do know the intent was for less kids to come into care, and we know that's happening, but again, for less kids to come into care, at least we would hope to see that families were being met with the services they need in the community to be successful. But really, the verdict is still out whether or not all of these changes and the fact that less kids are coming into care is actually more helpful or harmful. And we don't know if they're actually getting the supports that they need. We just know that they're not getting those ongoing supports through CPS. Now I'm going to pass it over to Emily real quick. And she's going to talk a little bit about what happens once kids do come into care.
Yes, thank you, Carrie. So we have seen another issue rise to the surface, which is actually a product of a capacity issue. Children without placement, or what you have heard referred to as CWAP. So when the state cannot find a placement for a child who either just came into the CPS care or disrupted out of their most recent placement for any number of different reasons, they are then taken to an unregulated setting that is not fully able to meet their needs. And then they're supervised by CPS staff or individuals that they've hired to provide around-the-clock supervision. So we know that these are kids that have typically higher needs. And as you can see on this pie chart on the right side of your screen here, it gives you an idea of what kind of setting they were in before the state was unable to find them in an appropriate placement to meet their needs. So they may have just spent time in a psychiatric hospital where they were deemed a danger to themselves or others. They maybe had just returned from being on runaway status. But alarmingly, a good portion of these are youth whose parents had relinquished them to the state because they couldn't get them the mental health treatment they needed from the community. So again, another scenario where supports aren't available in the community to keep families together. And on top of all of this, Texas is still in the middle of a federal lawsuit that has been going on for over a decade that continues to show that the state's child protection system continues to place kids at an unreasonable risk of harm. The lawsuit has revealed things like overburdensome caseloads leading to the agency agreeing to a goal of 14 through 17 kids per caseworker. It also revealed things like kids being placed in settings with long histories of concerning deficiencies, leading to the need for heightened monitoring of these placements and more enforcement in the regulatory process. It has also continued to shed a light on the fact that our state is in need of expanding our array of mental health services. And these are just to name a few. And while the state has made progress in remedying some of these issues, we aren't where we need to be just yet. And therefore, Texas will continue to be under the scrutiny of this lawsuit until we can make sure that kids who do come into custody aren't experiencing further trauma in its care. And I'll pass it back to Carrie.
This time I made sure to hit the unmute button. So with all of the issues going on in the system, we know that there's a lot of pressure to do something different when it comes to foster care. And one way that's being pursued is to move away from that one-size-fits-all state approach to one that's led by each community. The idea is that communities know their communities best and can adapt easier if necessary. You guys know this more than anyone else, probably. You guys are, definitely running full force here up here in the Panhandle with St. Francis Ministries at the helm. And so I won't get too in the nitty gritty because I think you all know what community-based care is, but just real quick, we'll remind you that, this is something that the state has broken up into 16 different catchment areas. And then, in each of those areas, the state will contract with somebody local there to carry out those foster care services. And just as a refresher, the blue on your screen is where it's already being implemented, and the green on your screen is where the state has received appropriations to move into those areas and move forward in implementing community-based care, but has not quite yet. And so just something else for you guys to know that have been around for a little bit, you've seen community-based care morph. One of the newest things here is, the opening up of the option for people to come and bid on areas based on what they are considering their communities. And so we're all just watching this really closely. And we do know based on what the Department of Family and Protective Services have said going into next session, they want to see community-based care implemented in 4 new areas. So we know that this is continuing, or at least the plan is to continue to expand. Like I said, we'll all be watching that really closely. So based on all the information, that we got from you guys, the data points that we're sharing with you guys today, what we know is we know what's going on in the system, and we know that it continues to show that this system's in a perpetual state of crisis. And so we can confidently say that we know we need to be providing better supports for families and children all around. And that's what, I think all of this information has really pointed us to, which has helped us actually lay out our legislative priorities going into session. And so we're going to enter into a little bit of time talking about those a little bit more specifically, and then we'll go into breakouts. But I'm going to pass it back over to Brittany, I believe. Yeah.
Thanks, Carrie. So our first prevention act for this legislative session is going to be to, of course, support PEI, which is the Prevention and Early Intervention Division of DFPS, in their funding request for prevention support throughout the state. So recently, DFPS released what's called a legislative appropriations request, and you might hear this referred to as an LAR. And this document asks the legislature for increased funding above the base budget for priority items and programs moving into next session. And we saw from that there continues to be, really that renewed attention on the importance of prevention type services like home visitation, resource and referral, and navigation services for families. We were very happy to see that there was an exceptional item included in that legislative appropriations request to expand prevention and community well-being services by requesting $85.56 million over the base budget to expand home visitation programming by 50%, as well as a $2.3 million ask to support marketing and just the prevention campaign around the Texas Parent Helpline that I mentioned earlier. This is really a substantial and historic ask and an increased ask in the prevention budget for the department. And again, just points to that larger shift that we're seeing around the state in support of prevention services. So we will, of course, be actively advocating and supporting the department in this request during the 88th legislative session. As you can see on this slide, prevention and early intervention services currently make up just 5% of the DFPS budget in comparison to spending on child protective services. We really must prioritize meeting families and offering support to them before a crisis occurs. To do this, we are going to have to increase investment in supportive type services to help families get access to the services and supports they need at the right time. So of course, we would love to see, this pie chart kind of flipped on its head a little bit and see that increased support in prevention services. And our next prevention legislative priority is to scale and expand universal prenatal and postpartum home visitation services statewide. So evidence has shown us that short-term postpartum home visitation improves maternal and child health and well-being, while also connecting families to the resources and support they need at a very vulnerable time. So in the weeks leading up to birth and immediately after birth. Universal means that these types of programs will be offered to all families, regardless of income or any other eligibility criteria. And these programs are also voluntary, which is something that I definitely want to point out to you. And as you can see on this next slide, 1 in every 10 children in the US live in Texas. And we know that this number is expected to continue as more and more families move to Texas, which I'm sure you all have seen probably in your communities, your populations increasing, and because of the recent jobs decision. So we know there are a lot of young children and families in Texas who have access to these prevention programs already. So as you can see here, about 1.8 million families in Texas have children under the age of 6, and about 413,000 of these families may benefit from home visiting services based on a few risk factors. But less than 5% of families who could potentially benefit from these home visitation prevention services are actually receiving them. And as you can see here on this next slide, in the Panhandle area, about 900 families were served with prevention services through the Prevention and Early Intervention Division in 2021. So what do we know about these prevention services that are offered through PEI? We're going to look at a few outcomes here from 2 different home visitation services that are funded through PEI. Family Connect, which is a universal postpartum home visitation program in which a nurse completes 1 to 3 home visits in a few weeks after delivery. And Parents as Teachers, which has been around a long time, and I know you all are probably already familiar with. But as you can see here with the Family Connect program, families who participated saw a 30% reduction in maternal postpartum depression and anxiety symptoms, a 50% decrease in infant emergency medical care in the first 12 months of life, and 44% fewer CPS investigations at 2 years of age, and then another 39% drop in CPS investigations at 5 years of age. And then with Parents as Teachers, research has shown a 22% decreased likelihood of child maltreatment substantiation and 50% fewer cases of suspected abuse and neglect. So all that to say, we know that these home visitation programs are offering successful outcomes to the families who have access to them. And we know that they work to protect children by connecting families again to those resources and supports that they need. So our strategy this legislative session is to scale and expand universal postpartum and prenatal home visitation programs statewide through legislation and a possible budget rider. We had a similar bill and budget rider last session on this same subject that was championed by Representative Donna Howard. We were excited that this bill had a lot of bipartisan support, but it just didn't quite make it to the finish line. And just as a reminder, this bill would create a competitive grant program within the Department of Family and Protective Services Prevention and Early Intervention Division that would be able to accept funds from multiple sources and distribute them out to community providers for the expansion of voluntary home visits for caregivers of infants. I'm now going to turn it over to Emily to talk about our next prevention priority.
Thank you, Brittany. So we've spoke a lot about prevention with home visitation and other services. And now I'd like to speak on prevention just a bit more in regards to our ACEs priority. Sorry. As most of you know, our aim with this bill is to make strides in improving the delivery of prevention services and increase the availability of these services so that all families and children from all backgrounds can access them in order to prevent ACEs from happening in the first place. And here on this next slide, we have a glimpse of the prevalence of ACEs in Texas. This is from the National Survey of Children's Health. And I will say, however, that the survey is based on parent self-report and it doesn't include questions about child abuse and neglect. So even these numbers are likely to underestimate the actual incidence of ACEs. So there's a lot here, so feel free to read this slide while I touch on just a couple. The highest percentage comes from children that have experienced the divorce or separation of a parent, as approximately 1.8 million children have been impacted by divorce or separation, which is about 1/4 of children in Texas. The second highest was the 12.4% that reported that they had difficulty paying for food and housing from their household income, and that was reported as somewhat often. So while this data is crucial to understanding the prevalence, I just want to remind everyone that these numbers do make up hundreds of thousands of children's real life experiences. Okay, so on this next slide, we know that often adverse childhood experiences can often be traumatic experiences. And we also know that trauma can increase the likelihood of negative outcomes across the lifespan development. Trauma poses great risk to mothers and babies as it can increase health risks during pregnancy and cause preterm births and low birth weight. It can also cause significant deficits in brain development, such as cognitive impairment, and it has been proven to increase the likelihood of one experiencing a chronic disease such as diabetes, cancer, and others. In the school and work settings, we often see children being expelled from school, having a higher academic failure rate, and adults losing time at work in order to seek treatment. And lastly, we know that there's an increased rate of participating in risky behavior, such as substance use, violence against others, and unsafe or risky sexual practices. So now let's look at some of the economic impacts that ACEs can have. TexProtects estimates that in 2019, Texas spent approximately $52.9 billion on the lifetime cost of confirmed child maltreatment cases. Some of the most staggering numbers come from the national health spending cost, with $168 billion for illicit drug use and $160 billion annually for smoking. Research shows that reducing trauma within families can lead to better financial outcomes later. Those who experience 4 or more ACEs across their lifespan are 1.6 times more likely to live in poverty as an adult than those who have not experienced ACEs in their lifetime. In 2019, about 1.5 million children were living in poverty. So this ranks Texas at about 40 out of 50 states when it comes to the overall poverty rate. And all of the issues I have mentioned here today are reasons why we push the ACEs bill. This bill will help us connect with stakeholders and communities across Texas to better identify what is working and what is not to really tackle the cause of childhood adversity. It will give state agencies back community guidance to better identify strategies to increase effectiveness of state prevention dollars. We can then use these findings to propose recommendations to the next legislators so that we can continue to do what works, stop what doesn't work, and make children and families strong. So that wraps up our ACEs priority, and I'll now pass it to Carrie.
All right, y'all, we're in the final stretch before we do our breakout sessions. So we're going to talk about kinship. I know you guys are seeing one of our strategies on the screen, but we've actually got 2, so bear with me. So our ultimate goal here that we're striving for this session is for more children to be placed with relatives. And we're going to try to do that because we want to make sure that these caregivers have the supports that they need, because that will be so helpful in being able to make sure that we can place kids more with relatives and also just support those placements so they don't disrupt. So we have 2 strategies, and I'm going to kind of walk through the differences in them and make sure that we have some kind of common language here so you guys know what I'm talking about. That's probably the most helpful. So let's kind of start with some definitions. So what do we mean when we say kinship? Because we say kinship, relatives, we use those words a lot, very much interchangeably. So what we're talking about, relatives, or friends of the family who step in and care for a child when it's unsafe for them to remain in the home of their parents. We know that relatives step in at all kinds of scenarios, but ultimately when kin steps in and provides care for a child in their home when CPS doesn't have custody, that's called informal kinship placement. And then there's situations where kin step in and care for a child when the state does have custody, and that's referred to a formal kinship placement. So now that we're kind of on the same page, let's keep rolling. So you heard me mention 2 strategies. One that is focused on informal kinship placements and one that's focused on formal kinship placements. For informal kinship placements, what we have heard is there are 2 main barriers, financial and legal. When the state doesn't have custody, a lot of people don't know that there's actually no financial assistance from the department, nor any legal standing for an informal kinship caregiver to make decisions on the child's behalf. So to address this, we want to see a pilot program developed that would ensure the relatives are actually provided and connected to both legal and financial supports in order to prevent a removal. We want to make sure that there's a case manager assigned to the relative caregivers, so somebody targeted to help the relative caregivers and get them the resources that they need. And ideally, a court would be involved so that they can help make sure that some sort of legal standing is in place if the case is dismissed with the child remaining in the home of that relative. So, so that was informal. Let's kind of move into formal. So again, kids who end up being removed and placed in a formal kinship placement, these placements have an option to become licensed or not. And I imagine a lot of you on this call are probably more familiar with that process. For those who choose not to become licensed, we want to make sure that those relatives are actually receiving pay parity in line with what foster parents receive for the duration of time a child is placed in their home. And so I just want y'all to kind of have that in the back of your minds, but I'll explain what is the current statute so you can kind of see where we're trying to move to. But first, I just want to kind of touch on, the amount of kids, what we know about the data, how many kids are actually placed with relatives. And what you're seeing on your screen is at least 43% of kids in CPS care were placed with kin across the different regions. But when we actually looked into the numbers, there's really only a small percentage of relatives who actually decide to get licensed. So for instance, the number at the end of last August, so August of 2021, actually showed that a little over 8% became licensed. So that's not a whole lot of placements deciding to become licensed. And anecdotally, we've heard a lot of reasons for that. Something maybe in their criminal history check from a long time ago that's barring them from becoming licensed. Sometimes it can be something like family dynamics, that they don't understand why they need to become licensed, or they feel like they're overstepping by becoming licensed. Or even just simply someone saying that they don't want somebody coming in their home, they don't want that much regulation. And so we've heard these, and I mean, we've heard a slew of these things kind of being at the heart of why folks don't want to become licensed. And it's also just a lengthy process and a lot of paperwork. I do, as I promised, I said I would kind of take us through the history and show you where we are now so you can kind of see why we're wanting to move where we're going. So really over time, we've seen the state more and more invest in making sure that we're supporting kinship caregivers, and we want to continue to move that needle. So I can remember a time back in the day when you were a kinship caregiver who wasn't licensed caring for a child in CPS custody, and they didn't receive any sort of financial compensation. And then at one point, it was a stipend. You could receive, I think it was $1,000, a one-time payment. But then it was back in the 85th, and TexProtects was a strong champion for this. And the way the current statute is written is actually what went into place back in 2017. And the way it's written is that you can receive up to half of what a foster parent can receive for up to 12 months. There is a 6-month extension in extenuating circumstances, but that is the way it's currently written. And then I do just want to say really quick while we're talking about the different funding, and before we kind of jump into the nitty gritty of what pay parity would look like, I do want to at least put on y'all's radar that we were excited to see that in the department's LAR for this upcoming session, there's actually a request for an additional $6 million, which would provide $1,000 to kinship caregivers to meet their immediate and concrete needs. And also for reimbursement of up to $750 to help with the licensure process. So clearly we see a lot of push to better support kin, which we're excited about. So when I say pay parity for the length of time child's in the home, what do I mean? So first of all, y'all heard me talk about that 12-month limit. We need to remove that 12-month limit. We want to ensure that relative caregivers receive compensation for the entire time the child is placed in their home. It just seems like common sense, right? We also need to remove that 50% cap. Again, they can receive up to 50%. We want to remove that that cap, but we also want to decouple it from the reimbursement rate. Right now, what's written in there is that it's half of the basic reimbursement, the basic rate reimbursement. So it's currently tied to the current rate methodology system. And y'all heard Christian talk about how we got to get those numbers right. And so right now there is a whole project underway to basically redo rate methodology in a much better way. And so we just need to make sure that this statute is written in a way that when that goes into effect, again, it's not problematic. And then another thing, just to put on y'all's radar, and maybe y'all have heard these stories, we've heard that sometimes kids are placed in a kinship home, but maybe the department doesn't approve the home study, but the court does. What we're hearing is that relatives don't get that reimbursement because they're not considered approved. And so we just want to make sure that whoever approves them, whether that's the department or a court, that if they are in that home, they're getting that assistance. So that is our formal kinship pay parity priority. Now I'm going to jump into data. You guys have heard us talk about this. Last time we came and talked to y'all about our monthly data priority. And, that was something we had pushed last session. Really, ultimately, what we're talking about is real-time data, because it's so important that that information is made available to the public in order to increase transparency, accountability, and effectiveness. We're talking about critical child protection information that has historically been made available annually, only updated once a year. But what we are asking for is for it to be updated monthly. And so, as we consider that, the state is moving to that, community-based care, where every community is going to look a little bit different, we definitely see that this is so necessary as the shape of foster care in Texas continues to change. And so I do want to show you guys, because I would call it partially successful last session. We were able to get a budget directive in to make sure that this monthly data was provided and updated monthly. And so what you're seeing on your screen is actually a screenshot of where this information is on the DFPS website. And what you're seeing on the right side of your screen is that it's basically whenever you click on any of these things, there's like a filter where you can actually click on the month and the year, and it's beautiful, it's great. And so, we just want to see that this continues. So if you're wondering, well, Carrie, why are you back at it again? They're already doing it. For those of you who are familiar with the budget process, it gets renewed every 2 years. And so instead of coming back every 2 years, each session asking for it to stay in there, we want to make sure that it's in statute so it will continue and it won't stop whether there's no longer pressure from a lawsuit, or if a commissioner changes and has different priorities down the road. It's just been so helpful. All right, then we're going to jump into our last one, and then I promise we will disperse for breakouts. But definitely not, it's last, but it's not least, workforce. I know there's a big conversation going on about workforce across the board. But when we say workforce, I do want to just make sure we're talking about those frontline workers. That's who we're talking about, those FBSS workers, investigators, alternative response workers, conservatorship workers. What we want to see is high quality workers all the way up the career ladder, not just on the ground, but also in positions of leadership. And so when we think about, how that needs to be tackled, we think about it from several different angles. You're talking about recruiting, hiring, retention, and promotion. And so I do want to just provide some data because it's what we do. When we're talking about recruitment, hiring, and retention, how can we keep people interested in working for the state? Or how do we get them interested in working for the state? And then once we get them, how do we keep them there? On this slide, you clearly can see workforce turnover. You guys have probably read articles recently about the exodus of workers for different reasons, whether that's because of CWAP, what Emily was talking about earlier, whether you hear about folks leaving investigations because they feel like they can't quite do their job the way that they want to. We've heard a lot of stories here. And so again, how do we make sure that we're drawing people to this agency and then keeping them whenever they're there? And we want to attract the right people, the high quality people to work here. And so we do know that pay is a factor. You guys may remember TexProtects, we were screaming from the rooftops back in the 85th, and we were very much behind those pay raises for the salaries for workers back then. And we're actually really excited to see also the department put in their LAR a 10% salary increase across the board for frontline workers. So again, pay is definitely a component of this, but I think we can all agree that it's just a component, but we need to be looking, much bigger, how do we promote a better culture and ensure workers are not overburdened? And so we did a little bit of digging. I've always been kind of curious to see what those, the pay differential, like what are we doing to actually make it desirable to promote for workers? And, you can see here, what we've actually done is some research. The state auditor's office actually shows that what folks are making at CPS, is actually in line with what the market shows. But again, like are we really incentivizing folks to move up that career ladder? And in a lot of ways, what we're hearing is like, okay, well, you know, if you move up the chain, you're tied to your desk a little bit more, so you don't get that travel check that kind of sweeten the deal each month. You also, like as investigators, you lose your stipend. For supervisors who move up, you know, you also don't get the overtime pay. So, you know, there's definitely some benefits factor in that as well. And so, you know, again, when we're talking about high quality, we're not talking about just any warm body. We want to fill, you know, positions all the way up the chain with those high quality workers, because they're making the life altering decisions, right? So, you know, when we kind of think about how to tackle this, you know, what we know is that currently the department already has to put out a human resource management plan every biennium. And ultimately what it does, it details their plan to retain workers. So again, it's just got that one piece in there. So what we actually want to see is them expand to more than just retention. We want them to also make recommendations for how to recruit, hire, retain, and promote that high quality workforce. So having the department go through that exercise, we think will be really helpful. And, you know, them kind of thinking through these things about how to, you know, again, promote that better culture. And also it will help us as advocates going into the next session. So the 89th, which is crazy to say out loud, but maybe they can give us some good recommendations that we can go to the legislature and advocate for then. All right, the time that I've been promising you guys, the breakout discussions. For those of you who were around last year and got to do this, y'all probably know the drill. It was so helpful last time. We want to do this again. You know, the information you guys can provide us is so helpful. Any sort of context you guys can give or updates or anything like that. Again, we're here to join forces. So we're going to have two. One's a prevention breakout room. One is on system involvement. So you kind of see those broken down on your screen. So we just ask that you choose the breakout room that you feel like you can lend the most discussion and information to, and go there. Brittany and Emily will be in the prevention one. I will be in the system involved one. And then looking at the time, we'll be coming back to the main room about 4:20. And so from there, yeah, we'll close this out at that point, but go ahead and choose a room and we'll have some more discussion.
Hi, Carol.
Hey, Randy. Is there I didn't see where we actually got to select.
Yes, what room would you like to join? Prevention or system involvement? And I can manually put you there.
System involvement.
Randy? If you don't see the option to join, please let me know and I can move you to a room.
Prevention for me, please.
Sonia, you should see the option to join. Jessica, where would you like to join? Monica? What room would you like to join?
All right, I'm going to give everybody a second or two to, I think everybody shuffled back, but let's see. Right. All right, is everybody seeing a get involved slide? Yeah. Thank y'all all also for putting up with my voice today. I don't normally sound like this. I don't normally sound a little hoarse and nasally, but thanks for bearing with me today. But we're gonna kind of close this out here. This is about the how you can kind of stay in tune with what we're doing, how you can get involved, those kinds of things. But thank y'all so much for participating in the breakouts. We know that it can feel like a lot to ask you guys to extrovert, especially at the end of the day. So kudos to you guys for sticking with us. And thank you for the valuable input. We always appreciate it. So again, before time is up, we just want to make sure that you guys know how to stay connected with us, to know what we're doing. And then of course, how we can all join arms and get these priorities across the finish line. So let's do that. So if you haven't already, many of you might already have done this, but if you go to our website, again, TexProtects.org. Also, by the way, y'all will get these slides and these things are clickable. So just know that as well. But if you go to our website and you scroll down, there's literally something that's orange on our thing that looks just like this. And you just put in your name and information. And that's the way that you can get our emails sent to you guys. We have really great stuff that we push out, whether we're doing events like this or we've got lunch and learns or different things that we're doing. It's ways for y'all to know what's going on. And then as we get into session, you'll get to also hear from us what we're working on, what the status of bills and priorities are, and just different things that are going on and ways for you guys to get plugged in. So this is honestly the easiest way to do it. Just put that name in and your email address, and we will make sure you're added to our distribution list. This next slide, so I won't go into all of these things, but ultimately, if you're looking for ways to get involved more specifically with us, we actually have several different ways you can get plugged in that you can see on your screen here. That first one, that know the latest, if you get signed up for our emails, that is how you can kind of take care of that one. Obviously, as we get into session, there's ways for you guys to get involved and have conversation with your representatives and different folks in your area. On our legislative priorities and things like that. And again, just being able to know what's going on. We will often try to resource you well. So don't just feel like we're asking you to cold call anyone. But, there's also things, we often share things on social media. So there's ways, if you guys see that we're advocating for something, you can do a quick share, things like that. And so also just that last one I'm looking at on the screen, advocacy alerts, again, you can get those through our emails. But one thing that we really like to be able to do during session, especially whenever things are moving very quickly, we often will provide you guys with verbiage if you guys want to get involved, but you're just not sure where to start. And so there's just really easy ways that we get you guys connected. And then if y'all are even more interested and you're like, Carrie, tell me more. I think it was around this time last year, or maybe closer to 2 years ago, we actually did a webinar for, how to be a champion for Texas children. So if you search on our website, I believe that's up there too, where we kind of go more in depth with how to engage with these different things. And then we've got a resource slide. Again, you guys will get these slides in the follow-up. And all of these things you can click on. We just wouldn't be doing our jobs well if we didn't resource y'all well. And this is just a small sample of what we have for you guys. So of course, what you can see on your screen, the state of the state. A lot of the slides you actually saw today, not all of them, but some of them, or we manipulated some of them, come from our state of the state, which is really where we take the past fiscal year's numbers and try to help them make sense to our audience of what you're looking at. And so we do go into more depth in that state of the state. So check that out. Obviously, we've got our flow chart. So I think you all who are joining us today are already pros on the system. But if ever you're just if somebody ever approaches you saying, how does this work? Or I heard about this stage of service. Can you maybe, explain what goes into that? We actually have those flow charts there that we have found to be very helpful. We also recently did a CPS 101 actually with our sponsor. So the Texas Child Welfare Funders. We just did kind of a quick CPS 101 to kind of teach some, that terminology. We love our acronyms, and we love, using certain terminology that really only folks in this space know what it means. And so we kind of go into that and what the goals of the system are and things like that. And then on the bottom of your screen, you can see some different reports that we've done that are in line with the different priorities that you heard us talk about today. So before we disperse for the evening, again, we want to extend our gratitude to our sponsor for the Texas tour, the Texas Child Welfare Funders. We're so grateful for what y'all do, and so glad that we were able to partner with you guys again. And of course, a big thank you to St. Francis Ministries. This Texas tour partnership goes way back with you guys, and y'all are always such a fantastic partner. Y'all do such fantastic work. It's a no-brainer when I think, who are we going to partner with in the Panhandle? I automatically think of you guys because y'all do such outstanding stuff. And so thank you for helping bring this audience here together. And thank you all for taking time out of your busy days. We know that the holidays are upon us, and our schedules are probably really scary if you look at our Outlook calendar. So thank y'all for choosing to join us here today and taking an hour and a half out of your time and providing us with feedback. So we're really, really grateful for you guys. And then last but not least, here's how you can reach each of us. Jordan wasn't on this one today, but she's also part of our policy team. But you got to hear from me and Brittany and Emily, and so our information is up here. If y'all have got any follow-up information or follow-up questions that you guys have, or if you're just like, hey, I'd love to have some more conversations, this is how you can reach out to us. So I'm actually going to give us a minute or two back. We hope that you have a really wonderful rest of your day and rest of the week. And I hope everyone has a wonderful Thanksgiving holiday.